Hello, everyone, and welcome to the National Organization for Rare Disorders monthly webinar for our member organizations. My name is Debbie Drell, and I'm NORD's Director of Membership and your facilitator for this meeting. I would like to thank everyone for joining us today. All lines are muted except for the speakers. This call is being recorded and will be made available after the webinar with link distributed in our e-newsletter. NORD's monthly webinars are a benefit to our member organizations that provide rare disease community leaders like you with information, capacity building, networking, and direct access to resources. In this time of crisis and uncertainty, NORD's policy team is working to advocate at the federal and state levels to address concerns related to COVID-19 that are critical to the rare disease community. And if you don't know who we are, this is NORD's membership team. We are working for you. NORD's mission is your mission, and your mission is NORD's mission. During this call, an issue raised or topic discussed may prompt you to think of a question that does not get specifically addressed within this half hour. NORD's membership team is always available to help answer this and any of your questions after this Zoom meeting is concluded. I encourage you to reach out to us with any questions after this meeting by emailing the email that you see on the screen. And this is NORD's mission. Our mission is your mission. For many years, people with rare diseases walked alone. Patients and families coped with a lack of treatments, lack of research, daunting medical and financial issues with very few resources. Then in 1983, a small group of patient advocates formed a coalition to unify this community and mobilize support to pass the Orphan Drug Act. In 1983, the coalition became NORD, the National Organization for Rare Disorders. For more than 37 years, NORD has led the way in voicing the needs of the rare disease community, driving supportive policies, advancing medical research, and providing patient and family services for those who need them most. This is NORD's mission, as you see on the screen. We are an independent nonprofit leading the fight to improve the lives of rare disease patients and families. We do this by supporting the 30 million Americans living with rare diseases and organizations like yours, accelerating research, providing education, disseminating information, and driving public policy, which is one of the reasons you're here today. Leaders of NORD's over 310 member organizations are entitled to all these resources that NORD provides, including a 37-year history of state and federal level advocacy and policy, communications, public awareness, our education initiatives, our patient assistance programs, the Natural History Registry platform that is proprietary to NORD that we worked with the FDA to develop, all the research and all of the CME and other programs that we've developed. So the agenda is very basic. It's a 30-minute call, and we're going to follow what you see on the screen. I'll be making some brief announcements, and then we're going to turn it right over to policy. After the policy team has a chance to present the NORD response to COVID-19, if there is time, we will do Q&A. We'll collect questions throughout this Zoom meeting, and our presenters will respond to them during our Q&A time. How do you ask a question? If you're watching slides now and you're using the Zoom browser, there is a Q&A button located at the bottom of your window in the meeting control bar. To use it, click Q&A button, open up the box, and then type in your question. You can ask questions anytime during the presentation, but please note that we will address them at the end, as some of the questions will be answered during the course of our speaker's talk. So now into announcements. NORD has heard a lot from our member organizations, and leaders like you have told us that COVID-19 has created incredible obstacles for your organization, especially the rapidly changing demands on your infrastructure, including crisis communication, telework, cancellation of gatherings, conferences, and very vital fundraisers. This has directly impacted your work and what you can do serving your patients, as well as managing research and trials. We've heard you, and we launched in response our new COVID-19 Rapid Response Leadership Series. The Leadership Series is a series of webinars and resources, and we are expanding our current capacity building and membership support services to provide these resources to you. So as you see here on the schedule, a lot of the topics are ones that we've heard on our Facebook group, including virtual platforms. We are bringing a an expert speaker for fundraising in a pandemic, and then we have other experts who are speaking on webinars about virtual platforms for conferences, crisis communications, and activating your board in a crisis. So that very first webinar that we're kicking off on June 4th is featuring Heidi Webb, who is a certified fundraising executive and founder and CEO of Green Kite Fundraising. And she is going to talk about how your organization can pivot during this critical time. Millions are currently unexpectedly unemployed. The economy has tanked. And how do you ask people to give money in this circumstance? And how do you ask them to give money when you can't bring them together and they can't feel the mission in these in-person events? As well as how do you engage your board? This is a really important talk, and we're really excited to make it available. If your fundraiser has been canceled this year, this is still going to be useful, as we are not sure when we're going to be able to bring gatherings together, even through to 2021. This is open not only to our member organizations, but anything that we're doing COVID-19 related that can support a patient advocacy organization. It's open now beyond the membership. We want to make sure that these vital resources for COVID-19 response goes far and wide. So now I am very happy to turn the presentation over to our special guest speakers. One of them you may not know because she's very new. I'd love to welcome NORD's policy team for this presentation. They include our Vice President of Policy and Regulatory Affairs, Rachel Scher, our Director of State Policy, Heidi Ross, our Director of Federal Policy, Michelle Adams, our Associate Director of Advocacy, who you may know, she's been at NORD for a while, Kristen Angel. She was also in membership at one point. Rose Gallagher, our Associate Director of State Policy, and Corinne Alberts, who is very new, our Policy Analyst in Federal Policy. So with that, I am happy to turn the virtual camera and microphone over to Rachel Scher to get us started.
Thank you so much for joining us today. We're really excited to have this opportunity to talk with you, our members. Of course, everything we do in the policy department is aimed at making lives better for the rare disease community, and we always have the interests of our members in mind when we act. So we really want to make sure we have opportunities for open dialogue with you all on an ongoing basis, not only in the form of these webinars, which we're going to try to do more of in general, but making sure that you feel like you have a face with a name and that you feel like you can work with us directly if issues arise for you. At the bottom of the slide that we're on right now, you see the policy at rarediseases.org, which is always a great way to get in touch with us directly if you do have specific questions or issues you think we need to be focusing on. I'm going to start out letting Kristen speak because she has to jump off in about 5 minutes to go to one of our virtual discussion groups, which we will talk about later. But Kristen, if you want to talk about RAN and the ambassador program, that would be great.
Great, thank you. Hi, everybody. I wanted to take a minute today and just talk a little bit about our Rare Action Network program. As most of you know, it's our grassroots-based advocacy network composed of volunteers, patients, caregivers, all stakeholders in the rare disease community. Our Rare Action Network state ambassadors are in a volunteer position. It's a 2-year term, and we have some opportunities for new ambassadors that we would like to bring on. And I thought I would just take a moment and share what the state ambassador role consists of. And then the next slide, I have a map explaining where we need some ambassadors. The state ambassador role is really the liaison between what happens in the state, both on a policy and awareness level, and kind of brings that back to the NORD team. They work with all of us on the policy team to go over issues that are impacting the rare disease community in each state. We go over everything. We do activities and events year round. We just made it in the nick of time for Rare Disease Day events before the COVID hit. We were able to execute all of them except one, so that was good. Our ambassadors work with other volunteers. Sorry, my cat's making an appearance. With other volunteers and really come together to get the issues addressed in their state, because what's happening, here in Connecticut could be completely different than what's happening in California. And, we are a great team here, but we're a small team, so we can't be everywhere all at once. And that's where that ambassador role really plays a key role. If you can go to the next slide, Debbie. Thank you. So this map here indicates where we currently have state ambassadors. The difference in colors is the blue are, state ambassadors, generally patients or caregivers, and the orange just represents ambassadors who are also running or a leader in a NORD member patient organization. And I always like to highlight that, especially to our members, to show that, we do have a number of members that are not only running their nonprofits, but also in the ambassador role as well. It's approximately 4 to 6 hours a month of volunteer work, and we're pretty flexible with schedules. We do some webinars and one-on-one trainings with all of our ambassadors. But the white states indicate areas where we need ambassador in. So if anybody has any people in your community or you personally are interested, you can simply email me or action@rarediseases.org. And I'd be happy to send you the application and give you more information on the ambassador program. I think that's it. Thank you.
Thanks so much for joining us, Kristen, and your cat.
Sorry.
Great. Thanks, Kristen. So I just want to take a couple of minutes to make sure that all of you are aware of where to find out about what the NORD policy team has been up to. And there are a couple of places that I want to flag for you. On the NORD homepage, if you go under Advocate, you will see a link to all of our policy statements. Every statement that we put out is basically put up there in real time and in chronological order. So you can look back all the way. We have not the actual links, but the references to statements dating back to the early 2000s, actually. But you can find the actual documents dating back to about 2015, if you ever have any questions about what we've done. But for purposes of the here and now, today, you can both look at the policy statements page and see the documents, but we've also lifted the COVID-19 specific documents and put them in NORD's new COVID-19 Resource Center, and that's the one on the right, of course. You go down to the drop-down menu and you'll see the NORD COVID-19 policy statement. So those are just the statements and activity that the policy team has been doing in the COVID-19 space specifically. And again, we get those up pretty much as soon as we do them, that within the hour or two after they go out. So if you want to go to the next one, sorry. The other place, of course, which hopefully you're already seeing on a recurring basis, is the weekly e-newsletter. We always work with Debbie and her team on the newsletters each week to make sure that we lift all of the content from the policy statements page and put it in the Rare Policy Corner, as you've seen in the member e-newsletter. So always pay attention there too. Next slide. Another thing that you'll find in our COVID-19 Resource Center, and it is also on the homepage, is the COVID-19 virtual discussion groups that the policy team has been running. We've done, I think, between 20 and 30 of them so far, and they are within each state and being led by each state's ambassador, as Kristen described. Really is just a way for the ambassadors within a state to bring people together from within that state to talk about the ways in which the COVID pandemic have impacted everyone. And they've been really a great success. I mean, it's successful, I think, for the community itself. We've had new relationships formed, really great conversation, but it's really important for the policy team too. We, members of our team, join each and every discussion group so that we can hear the conversation, answer questions, and really hear directly from the community about the ways in which the pandemic is impacting the lives of people in the rare disease community. So just urge you to check that out to the extent you are, your groups are based in a certain state. Look it up and see when they're going to be occurring, and please urge your members or anyone else you know to join. It is not open. It is open to not only RAN members or people associated with NORD, it's open to anyone. And indeed, we've had a real cross-section of people involved. We've had a lot of medical providers, caregivers, patients. So we are now looking at scheduling a second round of these discussion groups because people have found them to be so useful. So we just urge you to check those out. Okay, next slide. Okay, so part of the reason we also wanted to have this call today is to spend a few minutes delving into a couple of specific issues that we've heard, both in the context of the discussion groups, but also just in general are issues of concern for everyone in the rare disease community. So we're going to take a couple minutes to walk through specifically the issues of telemedicine and non-discrimination, and then I'll just reference the other issues covered here. And then we'll open it up for Q&A. So if I can ask Heidi, our Director of State Policy, to describe the telemedicine issues and what NORD has been doing, that would be great.
Hi, everybody. Thanks so much for joining us today. As Rachel said, when your disease or disorder is rare, it's often challenging to find knowledgeable healthcare providers within the city or even state where you live. And all too often, the specialized care rare patients require often means that patients and their families must travel hundreds of miles, sometimes across state lines, to see their healthcare providers or visit centers of excellence with expertise in their disorder or disease. And the burdens associated with this kind of travel can always be significant, but with the COVID-19 pandemic, such travel became risky or even impossible. And furthermore, many rare patients are immune compromised and could be at higher risk of contracting the coronavirus if they were to leave their homes and enter hospitals or doctor's visits for their medical care, doctor's offices for their medical care. So the states and federal government quickly realized that telemedicine could play an important role in ensuring patients still had access to their health care providers while reducing the risk of being exposed to COVID-19 by staying home. From a policy standpoint, telemedicine can be complicated. You have a myriad of state and federal rules and regulations that govern who can provide care to what patients, what telemedicine services can be reimbursed and at what rate, and how to ensure privacy protections for patients are maintained. And amongst other significant challenges that are being allowed during the COVID-19 pandemic, at the federal level, the Centers for Medicare and Medicaid Services is paying physicians now for the same for telehealth visits as they do for in-person appointments, and allowing patient telehealth visits to be reimbursed for either audio or video appointments, which is important for those who may lack access to broadband internet services. However, one critical component to increased access for telemedicine for rare disease patients is the ability to see their healthcare provider, even if they live in a different state. States are the ones that regulate what extent, if any, out-of-state physicians are allowed to practice medicine within that state. And with the crisis, many states had already adjusted their state licensure requirements to allow out-of-state healthcare providers to see patients. But in 20 states, those healthcare licensure requirements were hindering access to telemedicine. So NORD went into action and sent letters to governors in these 20 states on March 26th and activated our Rare Action Network, urging the community to contact their governors on this issue as well. And as of today, 17 out of those 20 states have since adjusted their state licensure requirements to enable out-of-state providers to see their patients via telemedicine. And this is in addition to the other 30 states that had already adjusted their licensure requirements. So 47 out of 50 states now are enabling out-of-state physicians to care for their patients while at home via telemedicine. Now, however, with telemedicine, many of these changes are directly tied to the COVID-19 emergency declarations. So NORD has heard how important this has been to the patient community, and we're going to be working hard to ensure the improvements to telemedicine that have benefited our community are maintained after this crisis. And Rachel, I'll turn it back to you to talk about non-discrimination.
Great. So the other issue that we wanted to just touch on, which is something that we heard about in the very early stages of the pandemic, is the question of non-discrimination. And specifically what that's getting at is the question that we all heard about, particularly again at the beginning of the pandemic, which is what do hospitals and other providers do in the event that the numbers of COVID-19 patients coming into facilities dwarfs the ability for those providers to be able to provide medical care? For instance, one of the things we heard the most about is ventilators. So if the supplies of ventilators were limited, how do emergency departments decide who gets the use of the ventilator? And there were some very concerning signals coming out of both states and in healthcare provider networks, hospital networks, about how those entities were going to go about making those decisions. NORD was deeply concerned and joined with several other patient groups to first and foremost work with the Office for Civil Rights, which is the office within the U.S. Department of Health and Human Services that is charged with the responsibility of overseeing states and others to ensure that the discrimination laws in this country are not violated. So we joined with other groups to send a letter first to the Office of Civil Rights and urge them, they did in the early stages put out some guidance to states and provider networks talking about how not to violate discrimination laws against those with disabilities. But we urge them to put out even stronger guidance so that those entities like states would not violate those rules. Also have been doing a lot with other patient groups to really police the states and see how they are rolling out their guidelines. And indeed, there have been some pretty concerning examples that we've seen where the guidelines would have permitted something that we think would have violated the anti-discrimination laws. For instance, by saying those with certain pre-existing conditions were just sort of de facto not eligible to use ventilators in certain situations. So we've sent many, many letters to different states urging them to work with us and the other patient groups who have been involved here to ensure that those guidelines that come out do not end up violating the rules, and to hopefully give the rare disease community a little bit more comfort that if indeed they do have to go into the emergency room, that decisions won't be made in a way that just says, oh, you have a rare disease, you're not going to get one of these ventilators or very limited medical procedures. So we've been very active in that, and some states have acted so far, and we're monitoring the others. But it's something that we know that we're going to have to continue to monitor. The numbers, as I'm sure everyone knows, with the pandemic are gradually going down, but I think there's going to be the need for increased vigilance as we head into the fall again from the numbers that we've been seeing. So we intend to continue monitoring this and advocate for the rare disease community in this area. So we have other issues listed here that we're not going to go into, but these are just the categories of issues that you will see if you go to the various places on our website that we just mentioned about how to find out what the policy team has been up to. These are all COVID-19 related issues, obviously first and foremost related to home infusion and ensuring that patients with rare diseases who are not able to get their normal infusion therapies were able to get it covered and provided in a safe manner in the home setting. We've advocated for increased COVID-19 testing. We've joined with other groups to try to address the need to avoid surprise medical billing, and we've advocated for robust paid family leave with respect to the COVID-19 epidemic. Okay, so that was it for the substantive issues. We just again wanted to flag that on the COVID-19 website, we have a policy issues form with yet another way to get information related specifically to COVID policy through directly to the team. The earlier slides, which you will have access to, also have just the generalized policy contact us form. So just wanted to remind you that that is there. And if we're going to go to the next slide. So we've got about 4 minutes by my clock, and happy to take some Q&A. I think we wanted to start out with one question that was actually mailed to us in advance of the webinar today, that I'm sure is a question that others have also had. And I would just ask Corinne to tell us what that question is and answer it.
Definitely. Can everyone hear me all right? Great. So we did get a question in advance of today's call that was asking about what sort of changes are being proposed to the Paycheck Protection Program and how these changes may impact the ability of our member organizations who received a PPP loan to have their loans forgiven. So over the last month, a lot of criticism has been levied at these large publicly traded companies that received paycheck protection loans that were intended to help small businesses and small organizations to retain and rehire their employees during this crisis. This spurred some lawmakers, most notably Senator Ron Johnson from Wisconsin, to call for greater limits to the loan forgiveness under the PPP. But as of yet, Senator Johnson hasn't actually introduced legislation that would limit loan forgiveness under the Paycheck Protection Program. The Treasury Department has asked these publicly traded companies to return improperly received PPP loans and are expected to conduct additional audits over the next few weeks. On the other side of this issue, we have seen bipartisan legislation introduced in both the House and Senate that would expand borrower flexibility and make it easier for small businesses to have their PPP loans forgiven. In the interest of time, I'm going to skip over a lot of the details of these bills, but both of them would extend the period covered by the PPP loan beyond the 8 weeks that is currently allowed. The House bill, which is sponsored by Representative Phillips, is expected to come up for a vote later this week. And we'll know more about the Senate proposal, which is led by Senator Rubio, once they return to Washington. So as with all things in this crisis, this may change very rapidly, but it's something that NORD will continue to monitor, and I'm happy to answer any questions that people have about the PPP.
Great, thanks, Corinne. We did have one more question come in the Q&A box about from Eileen asking about whether we do letters to ask for member organization sign-ons. The answer is absolutely yes, and we want to do more on asking all of you to join with us on these letters. To the extent, I mean, particularly this is the case during the COVID pandemic, I think there has been a issue both of having enough time to do that. When we have sign-on letters, we want to make sure that you all have time to digest the issue, get your questions answered, review whatever the draft statement is that we have come up with for your review. And oftentimes, particularly when we're talking about, for instance, communications with Capitol Hill and some of these COVID-19 packages that have been being passed, we're really limited on how much time we have to go through that process. But it is something that we have talked about as a team that we want to do more. We want to have more engagement from all of our members and have you, actually joining us with your individual names and groups on these letters. It's just that in the context of particularly this, there's been not enough time. The other issue I will just flag that prevents us from always being able to do that is when we are joining with other patient groups too, totally outside of NORD members. Again, those often are done on a very short timeline, and we have a hard time asking to have those opened up to our individual member groups. But thank you for the question. You are flagging an issue that we very much want to work on more, and we'll definitely try to do better about getting people involved on individual letters. And with that, I think we're at time. I'll turn it back to you, Debbie.
Really appreciate everyone joining us on our very first Zoom membership webinar. Very special thank you to Rachel and the entire team for presenting as they are working from the safety of their homes with their families nearby and their cats and dogs We thank you for this time. For you, all of our member organization leaders who have joined us for this presentation, if you have any questions, you can email membership@rarediseases.org. Thank you so much for joining us, and goodbye.